Good morning, everyone, and welcome on for this webinar on adaptive sport and athlete mental health. We are so glad that you could join us this morning. It's going to be a great panel. We have wonderful experts here joining us. My name is Margaret Domka, and I am the Executive Director of the U.S. Center for Mental Health and Sport, and I'm also a PhD candidate at Clemson University. Before we meet our experts this morning, I would like to quickly say thank you to the organizations that allowed this to happen today. So thank you to the U.S. Center for Mental Health and Sport, also to the Clemson University Department of Parks, Recreation, and Tourism Management, and as well a special thank you to the Christopher and Dana Reeve Foundation that made all of this possible. So today we're going to get into what some of the protective and risk factors are for participation in adaptive sport and how that impacts mental health. And we're also going to talk about how we can support mental health and ensure that athletes have an opportunity for thriving mental health within the adaptive sports space. Throughout this webinar today, if you have any questions or if there are things that you would like to make sure that we answer during our Q&A session, please make sure that you put them in the Q&A box that you see down at the bottom or somewhere on your screen, depending upon the type of device that you're using. So we are going to jump right into meeting our panelists and asking them some questions so that we can hear from the experts. As I introduce them, they have such impressive backgrounds. So I'm going to tell you just a little snippet of what they've done, but there's so much more that I could say about each of them. So I'm just delighted that they've all joined us. I will start today with Dr. Mark Allen, who is a psychiatrist residing in Denver, Colorado, and the owner of Peak Sports Psychiatry. He's a member of the American Academy of Child and Adolescent Psychiatry and the International Association of Eating Disorder Professionals, along with the International Society of Sports Psychiatry, excuse me. He's currently participating in the International Olympic Committee's diploma program for mental health in elite sports, and he has experience working with junior Olympians, collegiate, elite club, and high school athletes. Dr. Allen, we're so glad you're here with us today, and I have a couple questions that I'd like you to kick us off with right away. First of all, we all have a why, so I'd love to learn more about your why. And why are you doing work in this intersection of mental health and sport, and what drives you continue your work, along with whether you have a vision for the future of what this space looks like? And the second piece of this is I would like you just to kick us off with this conversation about risk factors and protective factors that exist in a sports space regarding experiencing mental health challenges and why it's so important to be talking about mental health. So Dr. Allen, I'll let you take it from here.
Cool. Well, thanks so much for having me. So again, I'm Mark Allen. I'm a sports psychiatrist here in Denver, and Margaret, thanks so much for having me. Also, just a plug, Margaret did complete the certificate program, at least for the International Olympic Committee's mental health and elite sports. So I thought it was pretty cool that we had that in common. And the rest of the panelists have a great background. So what is my why? I decided I trained in psychiatry and child and adolescent psychiatry, and I have always thought that the sports world, that the sports medicine has had a neglected space of mental health. It's always been a lot less, there's a lot less stigma associated with talking about performance than there is about stressful life events. And so if you're able to incorporate that and speak athlete and actually crack the stigma at the level of the macho athlete, it actually can have a great trickle-down effect on the rest of society, because a lot of times they're venerated as these superhumans almost. So part of where I came in today with the world of adaptive sports is that those who participate in adaptive sports are athletes first. They should not be identified by their disability. And we really do need to externalize that disability from the person so that they're able to participate like everybody else. And I think where we can really go with this is to note that prior to the disability rights movement actually starting, there was this stereotype that those who had a disability, this somehow was a medical condition that needed to be treated. And as a result, and somehow then there would also be a mental health sequelae associated with that. And I think that's discriminatory, and we should really try to fix that by talking about how instead mental health sequelae or symptoms could actually occur because of the society's response to that. It's uncomfortable talking about mental health in the first place, much less disability. And so there actually some of the discrimination that can occur with those who have disabilities, like social exclusion or stereotyping, can actually cause what the harmful symptoms that you may think was stereotyped in the past about actually having the disability as its core. So why do I love sports? One, they're fun. It gets you active. So talking about kind of like the actual benefits of sports participation, they can be very social. Yes, there are some individual sports, but the social aspect of sports is key, especially for someone who's in adaptive sports. There you go. You're with other people. This is going to be great. It could get you exercise. I can talk at length about the concept of exercise as medicine, especially for those with mental health related concerns. And really, there are some risks, and I can talk about some of the risks specific to the adaptive population, but I really wanted to more mention that because talking about mental health is comfortable, it's really important to know the difference between the concept of 1 in 5 versus 5 in 5. Yes, 1 in 5 Americans will, at some point in their life, have a clinically significant mental health condition, but 5 in 5, or everybody, will deal with some kind of stressful life event. And so really mental health is on a continuum, and we need to respect that. Adaptive athletes are certainly there as one of these people. And so really it's just, we're talking about the same conversation. So let's talk about what some of the primary risks are for those participating in athletic competition with and without disability. With a disability or without disability, you might run into the concept of getting injured. Certainly the concussion picture has come up. Being cut from a team, there's increased pressures from parents and coaches that can come up with being on the team. Overtraining, there can be a financial burden associated with it. And all of those things are also in the adaptive athletes. The difference, that I think a key difference there, is that sometimes we need to actually identify the overtraining concept versus what sports fatigue versus what actually may be related to their disability, and figuring out to make sure that which is going to be super important. Also, if someone's participating in adaptive sport, they may actually be misclassified based on their disability, and if that's so, then that's also discriminatory, and that's not good. Lastly, the Paralympic movement was there's actually the definition for a Paralympic movement was to enable para athletes to achieve sporting excellence and to inspire and excite the world. Whereas the IOC, or the International Olympic Committee, the non-disabled group, was to build a peaceful and better world by educating youth through sport practice without discrimination of any kind. So notice how in the Paralympic group, they're almost burdened by wanting to inspire. I do think they have the chance to inspire, but we need to allow them to do that.
Okay, thank you very much, Dr. Allen, for those opening remarks. Certainly your 1 in 5 versus 5 in 5 stat was really interesting way to think about it. 5 in 5 people will at some point experience something that is stressful in their lifetime. And so it's a great way to think about it and why it's important to be talking about mental health in sport. Next, I would like to continue expanding on this with Dr. Jennifer Piatt, who is an assistant professor at Indiana University Bloomington in the School of Public Health, and also the owner of Jennifer Piatt Consulting. I said it incorrectly the first time, Jennifer Piatt. She has worked in the healthcare field as a recreational therapist in acute mental health, physical medicine and rehabilitation, community recreation programs, Paralympic clubs, and adapted sport camps. Her research focus is in the area of mobility impairments, primarily in spinal cord injury and community participation. And I love this, she launched the first wheelchair basketball team at Indiana University. So that is awesome, Dr. Piatt. So thank you for being here today. And I would love to hear from you as well. Same thing from you. What is your why and what do you envision in the future in the space of mental health and adaptive sport, along with just expanding on this idea of what are protective factors and risk factors? I know that you've really been immersed in this in working with individuals with spinal cord injuries and things. So what are some of those unique protective and risk factors for adaptive sport athletes?
Well, thank you again so much for inviting me for this webinar. And it's I was so honored to be speaking with the other panelists today. And I'm going to just, because I love it when we do webinars, that we can do just a conversation. And so one of the things that first comes to mind is just even looking at, so when we launched the wheelchair basketball team, we really looked at some of the risk factors that we were looking at is just people having the college experience. And one of the things that Dr. Allen talked about that really resonated with me is a couple of things, the 5 and 5, like you talked about, and the 1 and 5 is some of the risk factors that we saw and why we started to launch the wheelchair basketball team is we actually took it from a little bit different perspective from, I would even say your traditional, everyone who is engaged in our wheelchair basketball program has a disability. And we looked at it from this embracing inclusion, and that the sport equipment was merely equipment, but we wanted to provide an avenue for college students to just have an experience like every college student walking on campus at IU. And so the wheelchair, the sports chair has become a piece of equipment that that anyone can use to come together as college students who love sport. One of the things I think one of our individuals who helped us launch the wheelchair basketball team was very instrumental was Evan Davis. And he said, no one should sit on the sidelines if they, unless they want to, and that everyone should get on the court. With talking about risk factors in adaptive sport, and once again, using the college experience and even going back to what my why is, I would say my why is making sure every college student who I interact with has a positive experience and can really have equal access to all sport. So looking at some of the risk factors, that social exclusion is really, really important to look at, especially when you're working with college students with disabilities on campus. From some of, I can totally nerd out with some of our research that we've done and interviews, as well as just anecdotally talking with students, they will tell you their lived experience coming to college with some type of physical limitation, getting around campus, it's just a different experience. And one of the first things so what we've seen is this sense of social networking and social support that happens through the sport experience. So you have college students who are supporting one another's. And with that, we've been able to honestly navigate some close calls with, and with my 10 years of background in mental health with suicide prevention, addressing depression, anxiety, loneliness, and not having a strong sense of friendship. And what we've seen when the wheelchair basketball team started at Indiana University, that there was this strong group of college students that came together to support one another because they loved sport. It wasn't because everyone had a disability or everyone didn't have a disability. It was they loved sport. They wanted to collectively come together. And then it's also been a training venue, to be honest, for future recreation therapists who really want to go into adaptive sport. I think especially it's worth noting, and I looked at some of the other panelists' work, is post-pandemic, the college experience does look different. And I will tell you, this year, our first wheelchair basketball practice, we had, I think, 25 individuals show up. And these students are hungry to connect, to be engaged, and to really come together. So I think, did I answer all of your questions? I'm trying to think.
Yeah, I think you provided some great answers, but feel free to continue if you'd like.
Okay, great. Yeah, I think the other things, and just looking, I think the most important thing is that sense of community. That's what I've seen. And even when I started talking today, I heard all of this clatter outside of my office, which was a bunch of students who had just gathered. So I was like, oh my gosh, of course it's happening right when I'm doing a webinar, but maybe it worked out perfectly that it's just the sense of community through sport has been huge.
Yeah, thank you for that. Excellent.
You're welcome.
There's no way that we can talk about our world today and mental health and sport or any space really and not think about COVID and the impacts of COVID too. So I'm really glad that you brought that piece up as well. So thank you for being here and for starting that conversation again this way. And so next I would like to introduce everyone to Dr. Tarkington Newman, who is an assistant professor at the Department of Social Work at the University of New Hampshire. They are a chair of the research committee for the Alliance of Social Workers in Sports and a member of the Mental Health Research Advisory Board for the American East Academic Consortium. They serve youth populations from about 10 to 24 who are socially vulnerable or at risk for mental health and behavioral health problems. And their research focuses on promoting critical positive youth development through sport, the creation of positive youth development coaching programs and coaching education, and the use of social work practice in sports settings. Dr. Newman has 15 years of experience coaching track and field, and during that time has won the state championship with his team 3 times. That's awesome. Way to go, Dr. Newman. So, since you've done so much work with coaching and positive youth development, we'd just love for you to continue this conversation regarding what coaching, parenting, and athlete behaviors are that can help support athlete mental health and make for a really positive environment for positive youth development within sport.
Yeah, so first, thank you for having me. It's an honor to be able to to share this space with everyone, both the panelists and everyone in the audience watching. I think as far as when we're looking at sport, particularly with young people, so people, 10 to 24, maybe a little bit younger, maybe a little bit older, and kind of to what other folks were talking about is sport provides the opportunity to develop meaningful and long-lasting social relationships with other people. And I think that ultimately is one of the true beauties of sport, regardless of its form. And so I think for coaches, for parents, for administrators, athletic directors, the best way to, I think, be supportive and kind of develop this inclusive climate related to mental health literacy, is just being open to listen. I think the ability to talk and engage is critically important to really understand where somebody is coming from, to understand the protective factors, the risk factors, the stressors that kind of encompass their life. But I think even more than talking and kind of dialoguing, it's just the ability to sit back and listen, be empathetic, to just take the time and to really try to understand where that person or where those folks are coming from. And I think ultimately that is always my take home when I'm working with coaches. I would also say coaches, parents, again, administrators, they don't need to diagnose. They certainly don't need to treat any type of mental health concern. But I do think that they need to listen. And I do think that they need to be willing to engage in the conversations if young people, athletes, whoever it might be, want to kind of talk about what's going on with their mental health. And again, mental health, much like Mark said, is very much on a continuum. Folks can have amazing days, and then folks can have really tough days. And everyone, again, kind of that 5 and 5 will have both tough days and those amazing days. And I think it's ultimately, as service providers, care providers, coaches, whoever it might be, it's really trying to understand where that individual, where that kind of group is, and when you're working with them. And so when I'm working with coaches, when I'm coaching, I often really try just to take a minute while practice is getting going, while a meeting is started, whatever it might be, just to check in with everybody, just to say, hey, how's their day going? To provide that opportunity and to then provide them that choice of sharing their experiences. Not everyone certainly is going to, nor do I think that everyone should if they don't feel comfortable. But I think just doing that 60-second check-in at the beginning of practice or at the end of practice or at some point in that session is really important, because those little dynamic conversations can have really tremendous ripple effects, whether it's for the good or for the negative, depending on kind of how you may react or how you may respond to things. But again, to some extent, I don't think mental health literacy is that tricky. I think it's just being a vested partner is really just taking that time to listen, trying to be empathetic to where, again, that individual, that group might be coming from, and trying to understand what's going on in their lives. Because again, like Mark said, when we talk about athletes, when we talk about somebody who might be engaging in disability sport, parasport, it's their people first, then their athletes, and then their whatever else kind of might be going on in their world. But I would really encourage folks to, just because they're an athlete or just because they might have something else going on in their life, disability, mental health related, it doesn't mean that they're not a person. And so I think it's really important just to treat them as people.
Great. Thank you, Dr. Newman, for that. Great information. What I'm hearing you say and everything is that we don't necessarily need to be mental health professionals to make a huge difference in the space. We need to be able to start conversations. And what I heard again and again is we need to be able to listen to each other and what concerns are. So that is what we're going to do right now is we're going to listen to our next panelist, because this next one is just as impressive as all the others. So delighted he is here with us. This is Nathan Mayer, a Team USA power soccer athlete. So he gets to talk to us about his lived experience in sport, and so glad he's here. He is also the executive vice president for US Power Soccer Association, and he fell in love with the sport of power soccer as soon as he was introduced to it. Nathan, you can see my background. I have lots of soccer balls, so I fell in love with soccer as soon as I saw it too. He always had a dream of playing for Team USA, and now he spends many hours in the gym every day practicing and getting ready for his games because he is on Team USA, and he has served as the starting goaltender for Team USA. He has won a World Cup silver medal along with an America's Cup championship. He also is a 4-time national championships winner, a Premier Cup runner-up, and he has won the Golden Guard Award. Nathan, I would say you're living your dreams. That is pretty amazing. And I'm so excited for you, and also excited to hear a little bit more about your story. And so if you could just share with us a little bit about how you got involved with adaptive sport and specifically power soccer, what keeps you playing every day, whether your experience has made an impact on your life off the court or it impacts your mental health at all.
Yeah, definitely. Thank you so much for having me here. I'm super excited just to talk about this topic, and I get to talk about soccer as a whole. That's kind of a dream come true right there, is just to be able to talk about my experiences and be a part of this amazing group of panelists as well. So yeah. I got started playing adaptive sports when I was around 4 or 5 years old. I didn't find power soccer until I was about 6 or 7 years old. But I always knew that I love sports, and I really love being competitive, and I wanted to be an athlete. And I've heard conversations between my parents about how when I was diagnosed, my dad never thought he'd be able to coach me as an athlete. And when I started to get involved in sports more, that reality of me being an athlete was starting to become true. But the other adaptive sports that I was playing, like adaptive t-ball and floor hockey, weren't really filling my competitive nature. And then when I found power soccer, I fell in love immediately. It was the sport for me. It was fast. It was competitive. It was pretty much brand new at the time of me starting playing. So it was kind of a new sport to the U.S. It started in France and came over to the U.S. So it's been really cool to see the journey of the growth of the sport, but nobody thought that I would be a competitive athlete, let alone at the world stage or winning national championships. And that doubt from other people is what keeps me going every day, is trying to prove that I belong on the court and belong as a person with a disability as an athlete. And playing power soccer has really given me the confidence off the court as well. And being able to talk about this kind of stuff. And I never thought that I would be able to do that. And just being around other people with disabilities and kind of learning what they go through and be like, oh man, like, yeah, I go through that too. I just kind of building that confidence and being able to talk about it. And I don't see myself as a disabled athlete. I see myself as an athlete. And that's what I try and prove to people every day, that I'm not an athlete with a disability. I'm just an athlete. And I'm just a person. I try and leave the disability part out of it. Yes, I do use a power chair, and I do have struggles in my everyday life, but I'm not constantly thinking about that. And playing power soccer and competing at the high level has allowed me to think that way, to just be an athlete and just be a person and not worry about the disability part. And that's really meant a lot to me and my family, and being able to do that. And that's what I try and tell people each and every day that I talk to them and be around them. Like, don't look at my disability, just look at what I can do outside of that. So that's what keeps me playing every day, is trying to prove to people that I belong, that is something I have struggled with. And that's kind of where mental health is a big thing for me. And it's something that I really try and focus on, in being aware that it's okay to struggle, but it's not okay to just sit in that struggle. Like, what are you going to do about it? So, mental health is a big thing for me, both on and off the court.
Okay. Thank you, Nathan, so much for sharing a little bit about your story. And so we heard it from Dr. Piatt, we heard it again from Nathan. The main thing is that we are really helping mental health when we provide sport spaces to all individuals, regardless of ability level, but let's treat everyone as athletes, as people, and as athletes first. And that's our primary focus, and we can really build up mental health with that as well. So again, I just have to say congratulations to Nathan on all of his accomplishments on the court as a power soccer player. It's incredible. So thinking about all of these mental health pieces, we certainly know that there are times that we recognize either within ourselves as people, or we recognize in others that potentially someone is struggling with a mental health challenge. And so I would really like to start moving on with some of our experts about what do we do in that situation when we are concerned? And so my next question is going to go to Dr. Newman about what are some of those signs that someone may be experiencing a mental health challenge, especially those signs that we can catch early so we don't have to wait a long time to get help. And also, how do we promote people to become really comfortable with sharing with us when they start having some feelings that something might be off?
Yeah. So I think, again, part of it is for those who are comfortable in kind of talking about sharing how they're feeling, how they're doing. I think just, again, it's that listening piece. For folks who aren't there or who don't feel comfortable, or at least comfortable in that space, there are some, I'll say, fairly identifiable signs for mental health. Again, athlete or not, mental health can kind of will manifest in really similar ways. And so there could essentially be like stark changes in mood and personality, just the lack of enjoyment about something, especially when we're talking about something like sport, which most folks will get into at least because they enjoy it. And so when you see a decline in motivation and interest of that sport, that can potentially signal some type of mental health concern. There's also, inattention, again, the disinterest being withdrawn. It's also, I would say, you can kind of see it a little bit more prevalent in sport because it is such a social context, is you can often tell if somebody's like having a bad day or is coping, dealing with something. There's often a number of people, even in the individual sports, at the individual level, everybody for the most part still trains with other people, still has coaches and what have you. And so there's always people and there's always folks around. And so you can, if somebody's kind of straying away from that group, or if somebody just looks not like their normal self, that's often a really good time just to go up and, maybe at the end of practice or sometime when there's not a lot of attention on that person, just go up and check in, see how are you doing, what's going on, or just that initial touching base can really open that door for further conversation. And then I think with that, it's when that door's been open, or when a coach, an administrator, again, a parent who's around, it's demonstrating the ability to be open and talk about mental health literacy, mental health concerns, demonstrating their ability to really listen empathetically really goes a long way into developing a more inclusive, welcoming culture where mental health can be prioritized and mental health can really be discussed. And I think it's when we're talking about mental health, behavioral health, we also have to, it's not much different from like physical health concerns. So we talk about those things pretty readily. In mental health, we really need to develop a culture where we can talk about those different issues that might be coming up, just like we would if somebody sprained an ankle.
Okay. Thank you. So Dr. Newman, again, great information. I think one of the things that I'm hearing from you is that we all need to be watching out for each other. And ultimately what we're looking for is those changes. They don't have to be big things. They don't always have to be the same things that happen to everybody, that this can look different. But when we notice changes, that's when we should be starting conversations. So thank you for that. In thinking about mental health in the adaptive sport space and starting these conversations, I really would like to now turn back to Nathan again to find out, what are you hearing about mental health in your space as a participant in elite adaptive sport? Are you hearing people talk about it more? Has that changed over your time? And does that impact, whether there are conversations or not around mental health, do you believe that it impacts the environment and the culture that you're in when you're trying to perform?
Yeah, definitely. Unfortunately, it's not a huge topic of conversation in power soccer specifically. That is something that I have been trying to change a little bit. I did go through an experience of getting cut from a team and really kind of going through a really low part in my athletic career, and it really messed with me mentally. I really didn't enjoy the sport anymore. I didn't want to go train. I didn't want to do anything with the sport. And I was like, man, like, this is a really big issue. I wonder if other athletes are going through this. So kind of going off of what Dr. Newman was saying, like, me as an athlete, I've been really trying to look out for my teammates, because I know what that really low point feels like, and I know kind of what those signs were, and really trying to talk to my teammates and be like, hey, are you good? Like, don't worry about it, it's fine. Like it's about the next play, it's not about the past play. So just really trying to bring that to attention, but it really hasn't been talked about recently as a whole. And I think it really should be, because it really messes with your head when you're going through something and you don't really think that others are going through it, and people won't really understand. And so it's kind of going along the same path of adaptive sports as a whole, that it's not really getting talked about much in like the general public sense, but it really should be, because adaptive sports are amazing for all types of athletes, and mental health is as well. So for power soccer specifically, it's not something we talk about often, but it's something that I've been really trying to change, because like I said, it really messes with your head when something doesn't go right and you're not really feeling like you have that support. So I've been trying to be the best teammate I can to make sure that others aren't going through that, and bring the attention to be like, hey, this is what I went through, and I really don't want you to go through it. So please just let me know if I can help with anything or stuff like that. So it's really understanding your teammates from a technical standpoint in regards to what move they're going to make here or there, but then really understanding your teammates from a mental standpoint. That way you can be the best team on and off the floor. So
Yeah. Thank you, Nathan. And thank you for doing your part in trying to make sure that this becomes a topic of conversation. It is so important. So we're all hearing from Nathan right now that this is certainly a place where we have an opportunity in further developing sport. And I'm sure everyone on right now believes in sport. Sport is amazing, and there's so much wonderful about sport, but this is a place where we have an opportunity to start talking more about mental health and making it a safe space to have those conversations. So in talking about these having symptoms potentially or signs of mental health challenges and starting these conversations, I think one of the challenges can be that not everyone recognizes that they have a mental health challenge, or they don't necessarily want to talk about it. So I like to move on to Dr. Allen and just ask you, have you seen circumstances where people are completely unaware that they're experiencing a mental health challenge, along with what do we do to support someone who is unaware or just doesn't want help at all?
This is an important topic. So a couple of things. One, I just wanted to echo what Dr. Newman had mentioned related to how it's just part of how you say things. If someone breaks their ankle, there's no stigma associated with it. So why can't we also then talk about mental health related concerns in that same light? Athletes from a prevalence rate, at least on the elite level, have the exact same prevalence of most mental health conditions, except ADHD and eating disorders. They have a higher prevalence rate, and they also athletics tend to be protective a bit for substance use. So, except for when they're using things for sports performance. As far as the concept of when people not being aware of something they may be having, anxiety is easy to spot even for the person suffering it, because your body tells you that it's on fire. I mean, your heart's racing, you might start sweating, the world feels like it's closing in on you. Depression, on the other hand, is incredibly isolating, and you do feel like you're alone. You feel like you're the only person going through it, and all of the primary symptoms that are associated with depression make you not apt to really probably reach out to get help. So a very easy acronym is something called SIG-E-CAPS. And so it's just, again, piggybacking on what Dr. Newman had already kind of brought up, but the S stands for loss of sleep or less sleep than normal. I is interest or loss of interest, or what we call anhedonia, basically not being willing or wanting to do things that you would typically enjoy, like sport. The G is guilt or unfounded guilt, just feeling guilty for no real reason about things. The E is a loss of energy or just sense of apathy. C is concentration. Basically, think of brain fog. It's real hard to focus. So when you have really difficulty focusing or concentrating, certainly then you're not going to want to talk about things. A is appetite. So lower appetite, these are all warning signs. P is psychomotor slowing. P, whatever, silent P. That's where like basically you both have a slowing in cognition as well as physical movements. And then the S is suicidality, which doesn't necessarily come up, but it's something you have to think about for these people. Because they're less willing to talk about it, if you're a concerned loved one, friend, coach, peer, whatever, you just need to talk about it. You're not going to implant thoughts into their head, especially if they might be suffering from thoughts of suicide. You're not going to make them act on it any worse. In fact, you're going to cut it out at the legs, and you're going to be talking about how we actually can get them help. And so just starting the conversation is exactly akin to the best way to treat anxiety, which is non-accommodation of anxiety. You have to like expose them to it. So getting them to accept that there might be something going on despite the resistance. If they may not necessarily like hearing it from you, but if they hear it from you and then like 4 or 5 other people, that can be helpful with getting them help. If there's an emergency, there's a brand new number, 988, for those that are struggling with suicidal thoughts that the government just added. So you don't have to call 911. You can call and talk directly to a counselor immediately, or you always have the option of taking to the ER. But use your primary care provider as the team quarterback, using a sports analogy, because they can make a lot of the referrals. And then if there's a mental health question, they can get sent to someone like me who can kind of tease it out and come up with a treatment plan.
Okay. Thank you, Dr. Allen. So again, what I'm hearing from you is that sometimes people may not be aware or may not want help regarding experiencing a mental health challenge, but even then we should still try to start the conversation with them, because they may hear us, they may not just respond right away. And if a few people talk to them, then eventually they might be more willing to get that help. So thank you for that. I also loved the acronym that you gave us. So I am going to ask Dr. Allen if you can put that in the chat box for everyone to see and remember. That would be fantastic. I think that's super helpful.
You got it.
So we just were talking about potentially sometimes people don't want help or don't know they need help. But for this next question to Dr. Piatt, I would really like to be thinking about those circumstances when we do know that we want help. But now, where do we start looking for that help? I know that I have heard from a lot of athletes that finding a professional mental health service provider can be a challenge, because they feel like if they don't talk to someone who, in addition to the mental health piece, has a background in sport, they don't necessarily understand what the pressures are on them or what it is that they're facing. And so now when we add sport and disability or adaptive sport to that, along with the mental health piece, where is it, Dr. Piatt, that we can start looking for people who have these backgrounds? Or if we can't find those people who have all of these pieces in their background, what should we look for to make sure that we can really be connected with the services that we need? Oh, you are muted, Dr. Piatt.
This is, thank you. This is, a great question, and really just, after listening to some comments from Nathan, Dr. Newman, and Dr. Allen, I think looking at the sport and mental health piece, there's a couple different ways to go. Is our background within recreational therapy, I would even say, and this goes back to some of my experience working here at Indiana University and with athletes, and some of the things that even resonated in this webinar with me, is starting at that level of finding someone that you can trust and talk to. So is key. And so on college campuses, the mental health services, they're being utilized, which is phenomenal. Sometimes we found that when we had some of our athletes who really needed some help, it may take a little bit to get in if it's not seen as emergency. So that sense of community, finding, there's different places you can even look as far as within recreation therapy, within the Paralympic sport clubs, and seeking out community mental health services. I know the number that Dr. Allen mentioned as well, that has come up several times on my Facebook page and others. So that's a great place to start as well. And just even them seeking out, going back to if they're involved with a sports club, feeling comfortable to talk with someone. And even within our experience as a recreational therapist trained in that psychosocial piece, is we've been able to navigate a lot of mental health concerns right away with, hey, someone isn't showing up to practice. And I would get a quick text of, and then I also know, were they showing up to class? Have they been communicating with other people? What's their demeanor during practice, even if they're coming to practice, as well as hygiene and grooming, connecting with other people. So I would say we've been able to navigate a lot before even getting to that level of where it's going to an acute state. So finding that sense of community is so important so that you aren't self-isolating, making it a conversation. Mental health is so, and I'm going back to the 1 in 5 or 5 in 5, we all just have life situations that happen. So being okay and really encouraging your athletes to say, hey, I'm having a tough day. Can we talk about it? And if sometimes a practice ends early and we've got to navigate some things just as friends, colleagues, peers, that's part of the whole sports experience. We're a team, and the team experience happens off the court as well.
Okay. Thank you, Dr. Piatt. So we're hearing it again and again today. Absolutely all of us can make a huge difference in this mental health space. It is a matter of paying attention to each other, starting conversations, having empathy when others are experiencing different challenges. Just our sport community is fantastic, and we can be the support for each other, in addition to also when people need support services beyond what we can provide as well. We know there are professionals out there for that. And thinking about those professionals, I think sometimes we don't know which professionals to turn to. It's maybe not as clear as sometimes in the physical medical health professions, because we don't talk about it as often. So today, since we have 3 different professionals with very different areas of expertise within this mental health space, I would like all of us to learn a little bit more from them regarding those specialties and how they can help. So I'm going to ask each of you so we have Dr. Newman, who is in social work, and Dr. Piatt, who's in recreational therapy, and Dr. Allen, who's in psychiatry. So I would like to hear from all 3 of you about who should use your services and when, and then what types of support or therapies they might expect. And finally, how do those treatments, or how does seeing you fit with sport participation? We certainly have heard athletes say, I don't want to get help because it might mean that I don't get to participate anymore. So who should use your services, and when should they think about coming to you, and what types of therapies or treatments, and then how does that fit with sport participation? So Dr. Newman with social work, I'd love to start with you.
Yeah, so I think anyone and everyone should seek out and engage in some type of, I'll say, like, mental health support. There are obviously, and some of the other folks can kind of talk about this as well, but there's a number of different types of like therapeutic modalities that somebody can engage in, whether that's like cognitive behavioral therapy, DBT, narrative therapy, more traditional just talk therapy. I specifically was trained in adventure-based therapy, or like wilderness therapy. And so for me, it actually really resonates well with sport, recreation, adaptive or parasport, because it's really using different types of physical movement, kinesthetic movement, to actually work through the mental health concerns or the different variety of things that folks may be dealing with. But from my experience, and in working especially with like teenagers, it provides an alternative method to really engage in deep conversations, because at first they don't need to verbally talk about something, they're actively doing. But a lot of the things, I'll say like things that may be impacting them or affecting them, tend to show and are really demonstrated when they're engaging in a variety of different types of activities, whether it's low ropes courses, high ropes courses, whether it's honestly just going out and shooting the basketball. Sometimes that being physically active or just up and moving somehow or moving some part of your body not only releases obviously different chemical endorphins, but also just provides another medium to then start to have those conversations. And so for me personally, I love adventure therapy. I'm very biased with that. But in part, it's because mental health, especially with young people, or I guess really mental health, just people aren't always comfortable talking about it. And being able to move in some way and being really engaged in some type of activity really opens the door in ways that somebody who might not be ready to really verbalize what's going on, that it'll showcase in other ways, and then you can have those types of conversations. But again, I think it's for individuals, it's ultimately figuring out what's going to be best for them. Everybody, is going to be attracted, and it's going to resonate differently with everybody. Whereas like just personally, I'm not one to sit necessarily and talk with a therapist about my feelings. I would rather, for me, be physically active some way, and those things will come out, and then I can kind of have those conversations. But again, it's different for everybody, and it's finding what works for you.
Okay, thank you, Dr. Newman. And so now moving on to Dr. Piatt with recreational therapy.
Yeah, so if you are seeking out resources or services from a recreational therapist, they will use really do an assessment and look at what are some of your strengths. So we use a lot of positive psychology. What are your strengths? What are some areas you may want to focus on? And then how might engagement in sport address both your strengths and weaknesses? So what you would expect from a recreation therapist in adaptive sport, really looking at it to where addressing clinical outcomes, some areas that you may want to work on, and really gaining that support either one-on-one, everything from what sports do you enjoy. Sometimes we see that we'll see this on campus too. It's like, oh, there's a wheelchair basketball team. Well, not everyone is going to love basketball. So even finding out if you're not into the recreation therapist, if you don't enjoy basketball, or maybe you want to compete for something else, what are your interests, desires? How can we improve your overall quality of life, while at the same time connecting you with the support system? And then once again, the recreation therapist may work with you individually, or you may be connected with peer support or a peer group. And then how does it fit within the sports participation is if you do want to get engaged in sport, the recreation therapist will look at what is the most appropriate intervention and what equipment and resources do you need to make that happen. So, and then we always work interdisciplinary with social work, with mental health workers, and with other team members, both in clinical areas, within as well as the community.
Okay, thank you. It is always really interesting to hear about the different options that are available to get support. So from Dr. Newman and from Dr. Piatt, I'm hearing that it doesn't always have to be that traditional office clinical setting of walking in and feeling like you're in kind of this industrial doctor's office space, but it can be a totally different environment that really can help support thriving mental health and encourage participation, so we don't have to feel like we have to take time away from that. So that's wonderful. Thank you for sharing that.
Of course.
And now we'll move on to Dr. Allen to hear a little bit about when we should use psychiatry services and what type of therapy we might expect and how that fits with participation.
So thank you. So similar to what Dr. Newman had mentioned, pretty much anybody can come in. I kind of want to take out the mystery of a mental health visit. Like, we're still people, it should be just a checkup, right? It's just a checkup from the neck up, right? Because that's the old joke. We want to be able to talk about your condition and make sure that we're not missing anything. But psychiatrists are, as I said, the mental side of sports medicine. We can really tease out and develop a treatment plan depending on what the individual needs. Athletes by nature find their primary satisfaction from action. And so like leveraging rec therapy, occupational therapy, things where you actually get moving and doing is really to your benefit. In my own practice, I like to exhaust non medication-based interventions first, because, well, athletes by design need to have tasks and doing so. I love working with athletes. They love lists. They love completing things and checking things off. If they do need a medication, meaning they have like clinically significant depressive symptoms that are being held back that we can't just simply talk through, then we can talk about medications as an option. But we are very mindful of side effects and want to make sure that we're using either side effects to our advantage, say they're not sleeping or whatever, but we want to minimize things that might impact their performance. So, golly, did you ever think that maybe addressing underlying stressors may make someone actually play better if you're getting at why that's causing, versus just doing a bunch of mental skills training, which can be helpful, but hence the concept of sports psychiatry versus just sports psychology. As far as working with someone, you don't just treat a patient in a vacuum, especially because I work with lots of kids. You work with the family, and then you work with maybe the team or the coach, and you want to get their perspective on things. So getting collateral information from teachers, coaches, and stuff is incredibly helpful to make sure you're not missing anything, even with an older person too, assuming you have consent. But really, we want to help make sure they know that talking about their problems is not a sign of weakness, despite the fact that in sports, you want to be considered mentally tough. At least that was the old adage. Being mentally tough is actually being able to talk about what's bothering you.
Good. Excellent. Thank you. So I think that is also a great contribution, Dr. Allen, because I think so often there's misinformation that if you go to a psychiatrist, they're just going to give you a pill and move on. And clearly that's not the case. They're going to have a conversation with you and really try to talk to you about what your situation is and what your priorities are, and as far as participation and continuing your own activities and what it is that's bothering you, what the best treatment is for moving forward, not just handing you a pill and saying that, well, we'll just do this, but really thinking together on how to solve the problem or the challenge that's being faced. So thank you for that. And so the next person I would like to talk to again is with this lived experience piece is Nathan. With where have you touched on a little bit, but throughout your experience as an athlete, you said mental health really is not talked a lot about in your space. So where is it then that you have found support? And I know you already said that you are a role model to other athletes. You try to help other athletes. Can you expand a little bit on how you do that and whether you feel like it does make a difference for them?
Yeah, absolutely. I mean, I hope I've been a role model for others. I guess I'm not going to assume that, but like I said, I went through a hard struggle in my sport, and I know what that felt like. So I'm constantly aware. I'm constantly looking for that in practice, in games, kind of how are they responding to certain situations, and not going up to them like during the game and being like, "What's wrong? Like, what's going on?" But like pulling them aside and like, "Hey, are you okay?" Because that wasn't a question that I was really asked when I was going through my struggle. So now I'm really making sure that my teammates and my coaches too are okay on the floor. And Dr. Allen, what you just said about being mentally stronger or mentally tough, like for me personally, I've always been trained, like, don't let your disability stop you. And that was kind of my same mentality, no pun intended, with my mental strength as well. Like, don't let your mental struggles stop you from what you're doing. So my competitive nature kind of took over, and I compressed it, and that was not good for my athletic part of me or my everyday part of me. And I really want to give a shout out to two of my friends that are in the audience, because I really opened up to them, and I was like, "Hey, like what, like I really just had to talk about it," and they were a huge help for me, and that's kind of where I have found my support, is just talking to my friends and my family and just kind of open it up to them. So I appreciate that from my friends and family. I apologize for kind of dumping that on you at times, but it's really been helpful for me on and off the court. So.
All right. Thank you, Nathan. And for all of Nathan's support out there, his family and his friends and the people who are here supporting him. So also very glad for Nathan and his willingness to speak out about this. It's not always easy to be the athlete who's speaking up when others are not. So really appreciate that you are on with us again today. So we're actually at time, but we're going to finish up with one quick lightning round to close out our session today. Thank you everyone for coming. But this last piece that I want to hear from our panelists is if there were one thing that you wish everyone could know about mental health and adaptive sport, what would that one thing be? So I'm going to start with Dr. Piatt.
Okay, well, I just made a little comment after hearing everyone, and so I'm going to say if you speak up as an athlete that you're having a mental health concern, you are giving permission to someone else on your team who may be struggling to speak up to also speak up. So it's so powerful. So don't forget that your voice may be helping someone else on your team.
Thank you. And Nathan, what is yours?
You are not alone. There are others that are going through the same thing, and don't forget that you are enough. You're unique, and really embrace that. Don't try and fall into the same trap. I need to hide this. Don't be afraid to talk about it.
Fantastic. Thank you, Nathan. Dr. Newman.
I think it's mental health, and talking about mental health doesn't need to be scary. And I think the first step is really just sitting back and listening. If somebody is willing to share kind of what they're going through.
Thank you. And Dr. Allen.
Well, the Paralympic movement was started as a means of providing rehab to those with disabilities and spinal cord injuries. Times have changed. You're not a person that has a condition that requires treatment, but rather someone who has a right to participate. And sports are fun, so please do that.
Yeah. Okay. Well, thank you to all of our panelists today. Thank you to all of you for joining us. They had great information throughout, great advice at the end. So really looking forward to continuing the conversation with these people. If any of you have questions we weren't able to answer today, you can send them my way. You should have my email address at the bottom of the invite emails you received, and I can distribute them off. But certainly appreciate you having you here. Once again, thank you to Clemson University's Department of Parks, Recreation, and Tourism Management that supported this today, along with the Christopher and Dana Rue Foundation. So glad to have them here. And this was produced by the Never Ends production studio, and we're very grateful for them too. So thank you all, and we look forward to seeing you back again sometime soon, we hope.
Thank you.